this afternoon, or that you think you might gain from it. So your name, your organisation, and what you'd like to get out of it. And while you're doing that, I'm going to move on to the next couple of slides. So first of all, why do we evaluate? In our world of analytics, we produce loads of different outputs, dashboards, slide packs, briefings, and so on. But how often do we actually stop and consider if we've produced something that has actually worked for our users? Do we know if they've ever opened it and accessed it at all? Has it led to a decision? Has it led to a change? Or do we just do this because we've always done it? So what our workshop wants to do today is that we'll be looking at the approach to evaluation taken by the Local Knowledge and Intelligence Service in order to ensure that we have a systematic approach to developing our outputs and products. And hopefully that will be of use to you this afternoon. So brief overview of the workshop. We're going to be having a little slot where we're talking about who we are in case you haven't heard of us before, and our approach to evaluation. And then we'll be doing a demo of our new evaluation framework, and we'll be getting you involved with that. And then towards the end, we'll have a section for questions where you can put questions in the Q&A, and we'll go through them afterwards. Okay. So before we go into learning outcomes, I'm just going to have a look at the chat, see if anybody, oh, Joe Wall has put something in there. So what would you like to do, Joe? You'd like to learn some tips for knowing how best to evaluate a public health intelligence product. Well, hopefully you will do that today. Is anybody else on the call would like to put anything in the chat? Or you're too shy? Okay, well, let's go through the learning outcomes then. So by the end of the session, we hope that you should have a greater awareness of the role of the Local Knowledge and Intelligence Service. And you should have increased understanding of the importance of evaluating intelligence outputs. And hopefully we'll understand how the evaluation framework can be used in your workplace. So I'm going to hand over now to Natalie, who's going to talk a little bit more about the service.
Yep, thank you, Sarah. So just a little bit about us to start with and why we think this is so important. We're from the Local Knowledge and Intelligence Service, as we said, or LKIS. We sit within the Office for Health Improvements and Disparities, which is part of the Department of Health and Social Care. We are a regionally distributed national function, which means we essentially are a national team with a presence and work programme in each of our 7 OHID regions. Our overall aim is to improve health through intelligence, and our day job is public health analysis. Next slide, please, Sarah. Thank you. So essentially, this is an illustration of a kind of brief overarching logic model of what we're here to do. Our inputs are our people, our LKIS team, our other public health intelligence colleagues, and the system around us, which allows us to access data, our programme management support, our business support, that kind of thing. We have 4 specific areas of work within LKIS. We have the actual analysis, creating our outputs, the coding, the number crunching, and the official stats that we produce. We have what we refer to as knowledge to action, which I'll give a little bit of detail about on the next slide, but it is essentially a work programme which tries to ensure that all the analysis we produce meets the needs of its target audience and that they're actually used, that people know about them, how to access them, and they work for them. We also have training. We all know that not everyone likes numbers, and maths can still be a massive turn-off for people. So we have a work programme that helps train up-and-coming public health analysts, but also how to engage with our tools and make best use of them for non-analysts. And finally, we have a role around public health intelligence leadership. Moving along, as I said, we are a regionally distributed national function, so we try to bridge that gap between national and local. So we're kind of that sandwich in between. And this leads us through to intelligence-informed decision-making, which is our end goal. So next slide, please. Thank you. So coming back to knowledge to action, some of you may recognise our knowledge to action cycle. We did a few sessions on this at last year's HACA, and it was mentioned in the triple threat analyst session this morning, if any of you were at that. Essentially, it's our way of working, and it's a continuous cycle from scoping and assessing needs and issues to planning what we're going to produce, to actually doing the work and creating a product or output, such as a report or a dashboard. And then you can see there evaluating if we did a good job. Did anyone actually engage with the output? Has it been used? Could we have done it better? Could we have planned better? Would a different solution have maybe worked better? Which is, of course, what we're talking about today. So then next slide from me. So this is just to illustrate that we have this cycle, but it's not just theory. We have a work programme that falls out of it. And this is just an illustration to show some of those examples. And you can see under evaluation, we have our standardised evaluation framework, and we do regular impact stories and reporting on kind of the outputs that we've done. So I think that's the last slide from me. Handing over to Katie.
Thank you. So I'm going to start by looking at why evaluation is so important to LKIS. It's central to how our teams in LKIS learn, adapt and deliver measurable impact. It ensures that our outputs are purposeful, evidence-based and aligned with both departmental and organisational priorities, whilst also contributing to real-world public health improvement. By placing evaluation at the forefront of what we do, it allows us to check that our processes are correct and to make any changes as needed. Evaluation allows us to assess whether the methods we used were appropriate, whether our objectives were achieved, and if any improvements are needed. In an often fast-moving, evidence-based environment, this clarity is essential for both accuracy, accountability, and effective delivery of the work that we do. It also provides insight into what works, what doesn't, and why. Understanding the reasons behind outcomes helps us to strengthen our guidance, our tools, and also our support for colleagues and stakeholders across both LKIS, DHSC, and the wider public health intelligence system. Finally, evaluation informs planning and prioritisation, which enables us to allocate resources effectively, aligning outputs with strategic goals, something which is increasingly important as we face potential wide-scale transformations and challenges in the future. Next slide, please. So, what is our approach to evaluation in LKIS? Within LKIS, we think that evaluation is not just a final step, and it shouldn't just be a procedural formality or a tick box exercise. It should be a consistent way of working across everything that we deliver. Because of this, our approach is to embed evaluation from the very start, ensuring that it's proportionate, purposeful, and tailored to the task. This ranges from light touch reflections to full-scale impact assessments and after-action reviews. Planning is critical. By defining aims and success measures early, we are able to capture the right evidence all the way throughout delivery and not just at the conclusion of a project. Evaluation also helps us to strengthen and drive continuous improvement. Lessons learned are collected, used and applied in order to refine processes, strengthen outputs, and provide more effective support to our colleagues and stakeholders. Finally, our approach evolves with the challenges that we face. We draw on best practice, we learn from experience, and we adapt our methods in order to evaluate a diverse range of intelligence outputs, including those which don't always fit neatly in traditional frameworks or have an immediately felt benefits realisation. Next slide, please. The development of the LKIS evaluation framework. So the LKIS evaluation framework was something that we developed to help bring consistency, clarity, and proportionality to how we assess our intelligence outputs. It offers a robust practical guidance, not just for our own internal colleagues, but for all stakeholders, both internal and external, who seek to make evaluation of public health intelligence outputs as straightforward as possible, whilst at the same time ensuring that evaluation is undertaken in a meaningful and impactful way. Our evaluation framework was shaped through a lot of work. We went through consultation with colleagues, we reviewed best practice, and we carried out intensive testing across a number of different types of outputs that we produce. The resulting framework is designed to be flexible, recognising that evaluation needs to be tailored to the scale, purpose, and context of each piece of work. And at its core, the framework sets out clear levels of evaluation, from light touch reflection through to full impact assessments. This tiered approach ensures that the evaluation we have and the evaluation that we use is purposeful, proportionate, and embedded from the very outset. It also provides practical guidance, clarifying aims, defining measures of success, and capturing evidence throughout delivery. By doing so, we believe it supports accountability, continuous improvement, and helps to strengthen decision making. And I'll now hand you over to Sarah for some questions via Mentimeter before we explore the evaluation framework that I've just touched upon in a little bit more depth.
Right, thank you, Katie. So yes, this is where we're going to get you to sort of take part. So we'd like you all to go onto www.menti.com and enter the code 16825686. I don't know if Katie or somebody could stick that in the chat. 16825686, or you can scan the QR code on your screen there now. So you might want to go onto Menti on your phone rather than your screen, but obviously leave that with you. Right, and I'm going to switch over to Menti and see if you're joining. There we go. So if you could do a thumbs up when you've joined Menti, that would be really helpful. I can see that people are there. So we've got 9, so we've got 18 people, I think, on the call. So
can you just repeat that code, Sarah, and I'll drop it in the chat? My memory is not great.
1682 5686.
Thank you. And James, I can see you've already done that ahead of me, so thank you very much for that.
Okay, so we've got 10 people joined already, so I'll move on to the first question. So what we'd like to do initially, before we look at the framework, is to ask you, how often do you actually carry out evaluation in your usual role in your workplace? Sometimes. I think everybody's putting sometimes. Nobody's put never yet, so that's positive. That's good. Okay, so we've got 12 people joined in, and 11 out of 12 have put sometimes. So I think we're getting the message here. So sometimes, yeah. So people, it's great, excellent that people are doing evaluation. Fantastic. I'm glad we didn't get a never, but nobody's done always. So that is the question. Should you always do evaluation, even if it's only a very sort of light touch evaluation? Well, that's something that we'll sort of discuss when we're looking at the framework, but there's possibly always some sort of evaluation you can do, even if it doesn't have to be hugely comprehensive. The point of the framework is that it's very flexible and can be used for really comprehensive or light touch evaluation. Okay, so I'm going to move on and go into look at the framework now. So the framework is hosted on our Public Health Intelligence online workspace, which is on Futures. So I don't know if any of you have already a member of the workspace. Some of you who are on the call, I'm sure, already are a member of the workspace, but if you're not, I would thoroughly recommend it. It's a really useful space for information public health intelligence wise. We've got sort of updates, events, resources, and regional workspaces as well in there. Now, the evaluation framework is in the resources section, and where we have a knowledge to action section, which Natalie was talking about earlier, and then an evaluation section here, which is part of the knowledge to action work. So once you're into the evaluation pages, there's a bit of a description about evaluation and links back to the knowledge to action pages there. And as you scroll down, you can see there's some further reading on evaluation. You can just click on little arrows to drop down to get a little bit more information with the links there, as you can see. So if you want to read around the evaluation a bit more, then you can some useful links. But the point of the framework is trying to make evaluation as simple as possible, because it can be a really complicated, quite a huge topic. And we're trying to just make it easy to grasp and easy to use, so that you can do it in your work without being too stressed about doing major evaluation. So if I scroll down and highlight the point here about building evaluation in at the start. So I think that was mentioned by Natalie earlier. It's really important to build evaluation in at the start of developing any output or intelligence piece of analytical work, because you need to build that in. If you want to understand what evaluation you need in order to design your output in the way to collect what you need for evaluation. So you might need to build into the metrics into what you're developing. So you want to do that at the planning stages and throughout product development. And obviously once it's been shared as well, you want to follow up with the evaluation to see if it's met users' needs and so on. And another thing to point out is about looking at any previous evaluation that has been done that's similar. So what we would recommend is so you have some sort of evaluation resource centre within your organisation where you can share what evaluations you've carried out, and have a lessons learned section where you can share what lessons you've learned from doing the evaluation, so that whenever you go to start developing another product, you've got that information there that you can use, that can give you some guidance so you don't keep making the same mistakes. Okay, so that's the introduction to the framework. Excuse me. This is the framework itself. So it's 10 steps, and you just click on the arrow to open up information for each step. So I'm going to start off with step 1, which is determining the level of evaluation. So click on the arrow. And really this is about prioritizing your level of evaluation. So how much evaluation, to what extent of the evaluation you need to do. So how we've developed this framework is we've got some factors here that we would consider which would indicate a higher level of evaluation. So say for instance, a lot of capacity is required by your a lot of resource by the staff on your team to produce an output. Now obviously that would need a reasonable level of evaluation to justify the capacity used. It might be of strategic importance. It might be contentious, and so that you want to evaluate it to make sure there isn't any disproportionate harm caused by it. Value for money, you need to, will the amount of work put into developing the output justify what it actually does at the end of the day. And a user demand, if there's a high level of demand for the output, you'd need to evaluate that to make sure it met those users' needs. But obviously you're going to have your own sort of criteria or factors that might influence the level of evaluation within your workplace. So these are just some examples for you, and at the bottom of the page here we can see two examples of the sort of level of evaluation you might want to do. So we had a public health analyst, public health intelligence analyst training program within LKIS, and so that required a lot of capacity, a lot of resource amongst the team. So we would want a higher level of evaluation with lots of different types of evaluation and mixed methods. Whereas if we wanted to run just a single regional network event, that would be a lower level of evaluation. That's just a single method of data collection. Okay. Let's go back to the framework. So step 2 is really, it's just reminding yourself about the output that you're evaluating. So you can't obviously evaluate something unless you really know what it was meant to do in the first place, and you need to know what the audience was in order to do the evaluation with them. So it's just a reminder that it's really important to make sure you're really clear about what the purpose was that you are for the item that you're evaluating. And then step 3, the logic models. Just look at this because sometimes people can be a bit intimidated, I think, by logic models, and can find them a bit sort of complicated, but then they're not really. They're designed to make it simpler and easier. And so if you are a bit unsure about logic models, we've got a presentation you can download here, which is a simple guide. And there's also an example of how it was used how a theory of change was used in an evaluation. But logic models would only really be needed for a more comprehensive evaluation. A light touch would probably not be required for that. So what I'm going to do now is go back into the Menti and ask you the next question. So if you'd like to return to the Menti, hopefully you've still got it out. If not, the code again is 16825686. I'm just interested to know if you use logic models if you're planning evaluation. No idea what it is. I had a feeling I might get a few of those. Right, that's a good mixture. And I'm really glad nobody has put I don't evaluate. Okay, so some of you, some always, so that's really impressive. I'm impressed with that. Some person has put sometimes, a couple of people have put never, that's fair enough. And 3 is no idea what it is. Okay, so yeah, if you do, as I said, that if you go into the framework and you can go, if I go back to it, you can see you can download that presentation, which gives you a really simple guide to what it is and a simple template for a logic model. But it is aimed to make things more straightforward and easier. So I'd recommend you looking at it, even if you decide it's not essential for your evaluation. So moving on to step 4, these are the different types of evaluation. So you should probably be familiar with these. but we just wanted to describe them in a simple way, so if anybody can sort of just pick them up and grasp what they are. Because I think there's sometimes you can get confused between what's the difference between outcome evaluation and impact evaluation, for instance. So this just helps to summarise which each type of evaluation is. So for formative evaluation, that's when you're developing an output and you want to continually get feedback from your users to make sure you're making it in the way to best meet their needs. And process evaluation is looking at the process in developing the output, so what worked well, what worked less well, and so on, and can be improved in the future. Outcome evaluation is, well, whether you've delivered what was intended. Did you say do what you were going to do? Was the output, did it meet the needs of users? How was it used? Whether it's impact evaluation is what difference has it made? What changes have happened as a result of your output? And we've also got a section here on impact reviews, which is more about embedding, sort of assessing impact into your work so that you can make sort of case studies really for the impact that you've made with your stakeholders. So I'm just going to go back to Menti again. So we're trying to get you working hard. And what I'd like to ask you is, if you say, for instance, we're developing a new dashboard, which was quite a major piece of work and for use by a range of internal and external stakeholders. Which of those types of evaluation would you use? So this is in reality in your workplace as you stand at the moment. If you were developing something like a new dashboard, it may not be that for you, but some new output. What would you, in all honesty, do? Would you do formative, process, outcome, impact, or none? So we've got some impact, some outcome. Right, that's a good nick. Okay, interesting. So it looks like the majority of, well, impact is the most popular choice there. So yeah, so finding out what the impact is and what difference it's made, that is really important, because obviously it justifies, the output and justifies your role in what you do. So that is obviously key. But it's interesting to see what other people have done. So, I mean, with a fully comprehensive evaluation, you would obviously want to do all of those. But in some cases that isn't possible, so you might just need to do the outcome or impact evaluation. But yeah, it's the whole point of this framework is it's flexible, so you can choose what you can do and what's feasible. Okay, let's go back. So we're looking at the design methodology here, step 5. So this is having decided that, say for instance, you're going to do outcome evaluation. You want to think about what method you're going to use to do that evaluation. So, and this is just giving you an example here of a project on for local data on health inequalities, just as an example. You might want to, for instance, do an initial survey to get feedback from users. You might want to follow up with a focus group to get more qualitative feedback. You might just want to have discussions at sort of partnership meetings. Or you might want to do process evaluation, where you could do an after action review, which is getting everybody who's been involved in the development together to sort of discuss how it went, the good and the bad. And we might do some breach analysis to find out what about the access of your output. So it could be sort of just downloads or people who've logged in. So I'm just going to move on to the next step, which is step 6, which is planning those research methods. So this is sort of a useful page which goes through each of those sort of potential methods that you could use and gives you a little bit more information about them. So if I drop down here, we've got there's a Word template here for an online survey or feedback form. Unfortunately, these are only available to DHSC staff because they're MSc forms, but you can access those and duplicate them if you are. And then we've got some instructions here of what you could do. So again, this is not meant to be prescriptive. It's just a list of the things that you could do if you were doing an online survey. So it's a bit of a crib sheet really, and a sort of reminder of things that you might otherwise forget. And this follows the same pattern for all of these. So focus groups, for instance, we've got a template for running focus groups, for doing interviews and network discussions, and again, some sort of guidance on how you could do that. And then for after action review, for process evaluation, we've got some guidance documents there that you can download and another template. So hopefully that will be useful. We're trying to make it as easy as possible so people can just sort of pick them up and sort of run with them, really. So I'm going back to Menti. I'm going to ask you another question now. You can probably guess what I'm going to ask you. So thinking about that output that we answered for the previous question, what research methods would you prefer to use for if you're doing outcome evaluation for the dashboard or whatever the item is that you're evaluating? Would you think about doing an online survey? Would you want to do focus groups as well? Would you think it important to do in-depth interviews? It's just to get a feel for what you would do, what you think would be the most important to do. So somebody's voting for an online survey, focus groups, after action review. Okay, just seeing the blobs coming in. Okay, so the online survey looks like the most popular at the moment. We've got 5. And I think that's probably not surprising because it's sort of quite straightforward, isn't it, to do an online survey and just sort of send that out. Whereas running focus groups or in-depth interviews obviously is a lot more time intensive and needs more staff capacity, not only to run, but to follow up and sort of theme the contents of the group afterwards as well. So feedback form is something that we usually use for, which we embed into our outputs so that it's there with the outputs so people can feedback any time. And reach analysis, I'm not sure how commonly people do that, but that's something that you'd need to build into the design in the first place so that you know about access or logins or downloads. And after action review, I think is actually a really, really useful way of finding out what worked well and what didn't work well. And it's really important to feed that into future sort of developments as well. And somebody has voted for self-reflection, so at the very least you could do some self-reflection. So yeah, that would be excellent. Okay, let's move back. I'm nearly at the end. Okay. So step 7, this is just a bit more information about the questions that would go into those research methods. So you'd want to ask questions that about the reach, how widely is the product known, how has it been used, its usefulness, how useful is it in meeting users' needs, the outcomes, how effective was it in delivering what it intended, the use, what it's actually been used for, and the impact, what has happened as a result of the product. So the recommendation is to try and include questions about all of those aspects, and those questions are included in the templates that are provided. And this just gives you a little bit more information about what the sort of questions would be for those different categories. It's just to give you a little bit of guidance on those. Okay. So after you've designed all your materials and then you carry out your evaluation, and then you prepare a report of some sort or other. So again, this is flexible depending on the level of the evaluation. So we've got an example here of the contents that you might want in a really comprehensive report, but it really depends on your audience and what the required reporting format is. It might just be a presentation, it might be verbal feedback, or it might be a full-scale report, but obviously that is dependent on what's required by your organisation. So I'm going to go back and ask you the last Menti question, which is, why would you actually share the findings? So you've written a report, you've done a summary, or you've done a PowerPoint. What is the point of doing that? Why would you do that? And who we're thinking about who you would share it with. So if you're sharing it with senior managers or with colleagues or project managers, can anybody think of any reasons why you would need to share the findings? Why is it important to do that? Yeah, why would you not just carry out evaluation and then never share the answers? Anybody brave enough to put a comment in? I'll give you a couple of minutes. Yeah, so people can learn from them. Very good point. To evidence the product has had impact. Because an evaluation should lead to change, improvement of some kind of next step. Make your work visible. Yeah, that's a good point. That it's sort of linked to evidencing impact as well, isn't it? To make a case for improvements or doing things a different way and the associated funding resources required for this. Absolutely, yeah. So it's not only about learning from particularly the process evaluation, so that you can make it better next time. But it's showing impact, making your work visible, evidencing that what you're doing can make a difference, so that you can obviously obtain further resources and funding. So instigate evolution of product to meet current and future needs. Yeah, so it's an ongoing process. So yeah, it's like lessons learned, feeding back, ongoing, like the cycle that Natalie talked about earlier. So whatever either you find out from your evaluation, you want to feed into the development of future products to ensure products are being best used to make a difference. Yeah, brilliant. So yeah, so in actual fact, it's absolutely vital, isn't it, to share your findings. Brilliant. Okay, so I'm going to go back to the PowerPoint. And just briefly before I hand back to, I think it's Natalie, some examples of how we've actually used the framework. So one example of a comprehensive evaluation, one light touch. So the comprehensive evaluation, this was of the Public Health Intelligence Analyst course pilot that we ran back in 2024. It required a lot of staff capacity in the evaluation, in the development of and delivery of the course. So we had 7 modules, it was all online. And so we wanted to make sure that to justify really the use of the staff capacity, and also to make sure that it was meeting the needs of our participants that were taking part, and to identify any improvements for the next cohort if we decided to carry on with it. So we did process evaluation, which was an online survey, some in-depth interviews and an after-action review. And we also did outcome evaluation. So we did an online survey with participants, which was, we'd had an evaluation form for each module. And then we also ran focus groups. And then we did some impact evaluation. So a year after the course was run, we followed up with participants, and we also followed up with their managers as well. And out of that, we identified any particular challenges and learning points which fed into the next cohort, next iteration of the course. And we designed the evaluation by thinking about why we were doing the evaluation, who we were doing it with, what we were actually doing, how we would do it, and when. So I think that's useful to sort of bear that in mind when you're designing the evaluation. So just moving on to the light touch evaluation. This was some analysis we did on emergency hospital admissions for violent injury, which were shared with public health intelligence teams to use with their violence reduction units. So for this, it was a less intensive piece of work, so the evaluation was slightly lighter touch. So we just did some outcome evaluation with our audience to find if the reports were fit for purpose and whether they'd actually been used, and also some impact evaluation about what had happened as a result of using the analysis. And doing that evaluation led to some changes. We produced the output in a different format. It made it more user-friendly and interactive, and we added a supporting data set. And we've also got some planned improvements in the future as well, which came out of the evaluation. Okay, let's move on. So hopefully that has been helpful for you. There's an opportunity for questions later. So if you've got any questions, please put them in the Q&A. But I'm going to hand over to Natalie now, who's just going to talk about how we incorporated evaluation into our work plan, and to give you some suggestions of how it might help you to do so.
Thank you, Sarah. Every time I look at the evaluation framework on PHI Online, I'm always blown away by how much content there is actually in there. All the templates and everything to just make it so easy. You're not starting with that blank sheet of paper of where do I start with an evaluation? You know that if you look in there, there's something that will help you think it through, help figure it out, and have some handy templates or background things that you can look at. Yeah, always blows me away. So these are just some ways we think you can incorporate evaluation into your work. The things that we did that we found helpful. Obviously, access the online evaluation framework. I saw Katie pop in the chat that there's a couple of people joined PHI Online already, which is fantastic. It's there to use the resources, get involved, have a look at it. Really important, and I know we've said this a few times, try and incorporate evaluation planning into the project scope. If you're already thinking about evaluation at the start, it doesn't then feel like an add-on the extra thing that no one's ever got capacity to do because you're too busy moving on to the next thing. If it's already part of the project planning and you know what questions you want to ask as part of the evaluation, it just really helps to actually make it happen. This is one we're working on ourselves at the minute, and it's that embedding of lessons learned and kind of a quality improvement line of work that we've got going on. So it's one thing having the evaluation, it's another thing actually learning from it and making changes and having that available to multiple people. So not just the people within the project team who did the output and them learning something. How can that be shared more widely within your organisation? CPD sessions for staff, we've run a couple of these now within LKIS and wider. Really important to just get people thinking about evaluation. We went through having evaluation champions, so just someone around who knew that little bit more, could help people access the framework, just were there all the time in an analytical team saying, come on, let's think about evaluation, championing that role. We were really lucky that we got some support from an academic at York University to help us with the framework. There are people around, and it's good to lean in and get some additional support when you're doing this kind of trying to embed evaluation into your work. And there's a couple more here. So if you're lucky enough to be based down in the southeast of England, Sarah has a wonderful evaluation community of practice that you can get involved with, and it's something we're looking at across the country if there's something we can do, but it could be within your own organisation, getting like-minded evaluation people together to help think about evaluation within your teams or organisations. And again, training, internal, external. It's part of our Public Health Intelligence Analyst course now, which we're really proud of, that it is incorporated. So anyone coming through that course on Public Health Intelligence now has to sit through us talking about evaluation. So we just never stop going on about it, is our basic tactic. Next slide, please, Sarah. Okay, so our top tips, I think I've said most of these in the last one. First one is just do it, even if it's really tiny, even if you don't think it's that important, even if it's just some self-reflection that lets you learn about your own part in a project that you can talk through with your line manager. You've learned something. It's really important. An after action review to think about the process, really important. So just dip your toe in and just do it, as it says there, unless there's a strong reason not to, but I can't think what that would be. Said this one already, incorporate evaluation into your project scopes at the outset of a project. I keep banging on about that, but if that happens, it's much more likely for evaluation to happen. Identify an evaluation lead early on within that project team. Again, it's just someone to champion evaluation and make sure it's being thought about the whole way through. And again, share learning within your organisation or more widely. So it just becomes the norm, I think, is what we're saying with that. Thank you, Sarah. Okay, back to Menti. So if everyone can jump back on and Sarah can alter some screens, thank you. Okay, so this is thinking about after this workshop when you're all super inspired to start doing some evaluation on public health intelligence, which I'm hoping you all will be by the end. So in what way could you use this framework within your team? Can you give me some examples? Can you start thinking about how you could use the framework that Sarah so beautifully went through earlier? This is where my self-reflection comes in, because I'm so bad with the silence. I have to try and stop talking. Yeah, perfect. Thank you for coming back to me so I'm not having to talk to nothing. Yeah, building evaluation throughout the process rather than just at the end. We don't want it as a tag on. We don't want it just bolted on and feeling like an afterthought. Really important to just have it throughout. Yeah, brilliant. Go ahead, explore the evaluation framework and see what you can take, even if you can just take a few little bits and start using. It's a start. Discuss with your team about some more evaluation. Perfect. We'd love it if you did that. Go through it in a team meeting so you're all doing it together. That would be ideal, I think. Okay, we'll move on to the next question. So what do you think maybe any barriers or challenges you might face when trying to use the framework, whether within your team, your organisation, or you personally? What do you think the barriers or challenges might be? Or maybe there aren't any, and everyone will be going ahead. Time, getting feedback, really good point. If you're trying to do a survey or have your feedback forms in and no one's actually filling them in, it's a bit disheartening. Getting senior buy-in, I think once they are bought in, it's an easy door to then push back on, isn't it, and get more. Highlight if things went wrong, all really good challenges. People don't want to change. Time's obviously getting bigger, so a few people have put time in there. Making it a priority. You've got the next thing that needs doing, the next important report to write, the next bit of analysis to do. So why are you working on something that you did 6 months ago and looking at the evaluation? It's not the norm at the moment. I mean, in perfect honesty, it really wasn't the norm with us, and we aren't saying we're perfect at it at all. But by having the framework, we've gone through a lot of these challenges ourselves, and we're still going through a lot of these challenges trying to get it embedded. But I think with us banging on about it so much, it is starting to seep through into our projects and how we work within LKIS. Uptake from colleagues, I feel it. I feel the pain with some of those challenges, totally. Next slide, please, Sarah. So I think this is the last question from me. So what's the one thing you can take back to your team after attending our workshop today? Perfect. The framework itself, that's an excellent thing to take back. Plan evaluation early, and just awareness that it is, I think I wrote it in the briefing for this, we're really good as analysts as creating great outputs, beautiful analysis. We want people to use them, but we never actually routinely go back and check it's being used. Is it sat on some dusty internet site somewhere or intranet site? And is anyone actually using it? Is anyone actually making a decision based on all the hard work that we've done? So, I think it's so important. Planning evaluation early. Absolutely perfect. Okay, next slide, please. Oh, back to the actual. Oh, thank you. Back to the actual presentation, I think. Back to you, Sarah. She can take all the questions.
So this is where I'll hand over to James. Have there been any questions? Or has anybody got any questions?
I'm just sorry. I was just waiting to beam back in there. There was I think Claire in Merseycare raised a hand earlier on. I don't know if Claire wanted to ask a question or had a point. I don't know if it was a presentation question or technical question, but I don't know if Claire. I don't know if Claire's able to ask the question or to put it into the chat.
Yeah, I did notice a couple of raised hands during the presentation, but I wasn't sure what we could do about them. So if people do want to ask now, please do.
Yeah, there is a question from Joe. Any advice on how to ensure feedback is representative? Who wants to take that one first? That's a good question.
So that's a feedback from when you're doing the evaluation with surveys or focus groups and so on. I think the important thing is to make sure you get the right sample, isn't it? So you need to assess who your audience is and who you need to sort of actually get to respond, and make sure you very carefully sort of choose your audience. So if it's a focus group, which it's difficult sometimes to get volunteers, but try and make it as representative as possible. And then you've got to sort of balance out your capacity with the number of focus groups that you've got time to do, with making sure you get a representative sample. But and then obviously when you do a survey, for instance, you might need to put on it, what type of organisation people are from or what locality they're in, so that you make sure you get a representative sample. I don't know if anybody else has got any. Natalie, Katie, got any other suggestions?
I think, again, I keep saying it, but thinking about it at the start means you can factor those kind of questions in from the beginning, so you know who you need to ask, you know who your target is, and then you can think about how to target the actual audience of the output in a more representative way.
Yeah.
And that's sometimes why you would need to use, and it depends on time and everything else and capacity, but that's why there are those different sort of strands of different ways in which you can target people, to try and make things as representative as possible, because obviously you don't just want to hear certain voices, and that is one of the dangers with evaluation, that you will only hear certain voices and that you might get a slightly misrepresented result as a result of that. So I think making sure you build that in at the very beginning, who are the people that you need to hear from, and just try to find as many mechanisms as possible to try and catch those people, across differing levels of seniority, across differing levels of usage as well. People use outputs for various different things. You don't just want it from one particular kind of end user, but I think that the framework helps to answer that really well.
Yeah, I think I certainly agree with that, Katie, and that obviously use a variety of methods of to get the feedback as well. So yeah, different audiences so you can get that representation.
I think Claire has now appeared on the screen. So Claire, if you're able to unmute, you can ask your question. Oh.
Or a question in the chat, perhaps?
Yeah, I might have to just drop that one in the chat if you can, please, Claire. There seems to be a bit of a technical issue with that one. Whilst Claire is doing that, Katie, it's probably just worth saying, you put your email, didn't you, in terms of follow-up for this session. Obviously, resources and slides and things will be available through the conference platform, but also it's probably worth saying something about PH Online, isn't it, as well?
Yeah, so there are the links in the slide pack there. There is my email there if people want to make a note of it. There is a link that takes you directly to PHI Online in order to sign in. But I must say that we have already had quite a few people from this particular workshop have already requested access that I've seen, and have already been granted access as well, which is fantastic. So yeah, if you navigate to resources, you'll see the evaluation framework in there. But there is also that that's not the sum of PHI Online's parts. There is an awful lot in terms of resources, discussion forums, and various different things that would hopefully appeal to the kinds of people at this conference. So yeah, but feel free to email me if you need any further help with anything that is either to do with PHI Online or anything that we've discussed here today.
Excellent, thank you, Katie. Have we got any further questions just for anybody got anything else to drop in the chat? For some reason, I'm not allowed to ask a question at the moment for some reason due to the foibles of the internet, but we'll persevere. I'm just checking there's nothing in the Q&A. So, Joe's put another question in, I think, about, thank you, Joe. We can cover that one. We've just got about 5 minutes left, I think. How can you encourage people to engage with an impact evaluation when it might have been some time since they used the output? So something about the time lag, I think, there. So who wants to pick that one up? That's a very good question, I think.
Yeah, I think that's a tricky one. You've got to do something that would tempt them, haven't you? And I know, because when I talked about the evaluation of the analyst course, and we wanted to follow up with the people that attended the training sort of a year later. One thing when you get them involved at the start. So in this case, when they came on the training, you're basically part of the agreement for coming on the training is that they're involved in the evaluation that follows up. So that's a given at the start. But also to do something that makes it more interesting for them to take part. So I think, from what I understand, we ran a session that was more of a sort of get-together, reunion sort of session. It wasn't come back to do evaluation as such, which it was, but it was sort of marketed really as a sort of come back and meet everybody again sort of approach. So it's a case of sort of making it more appealing, more attractive to people. So yeah, it's just phrasing it in the right way. And so I mean, if people don't take part in evaluation, then they're not going to get the products that best suit their needs. So it's just being persuasive, I think. I don't know if anybody else has got any other comments.
No, just quickly typing in there that there's always one of the good ways of going back to things and revisiting things is using case studies as examples as well. I know that's not directly answering your question, Joe, but that's kind of a way of reframing it and bringing things back in. And I think if there is any way of, I guess, anchoring things to current priorities. So, think about the challenges that might be ongoing now that might have changed slightly since when the original evaluation was done, but see if there's a way of bringing it back in to context that way as well. If you can do anything that will prompt people's memories of back when the output was created. Yeah, there's lots of different ways in which you can do it, but it just takes having a look at the resources that you've got and just seeing different ways that you can frame and shape things that make things still relevant to people during that particular time period, even if it has moved on in terms of the length and duration of time.
Yeah, I think it's important to make people feel that their feedback is valued. Sorry, Natalie, I was just going to say.
No, I was going to say the same thing, just what Joe's put in the chat, that I think if we're showing that we're listening and we're making changes based on previous evaluation, people are more likely to come back and tell us things again down the line.
Absolutely, yeah. Okay.
Excellent. I think now we are at time. So any other questions I'm sure folks will help with in the follow-up if you want to get into